My name is Dr. Nicolas Acquavella from the Sylvester Comprehensive Cancer Center at the University of Miami. I am a melanoma specialist, and I'm here to highlight what has been really reported at the current ASCO meeting 2007 here in Chicago. So we heard from the Keynote 006 clinical trial, really the confirmation about the superiority of pembrolizumab compared to ipilimumab, with a median survival of 32 months versus 15.9 months. Now, what's important and really valuable about this data set, it's the fact that 104 patients had completed pembrolizumab therapy after 2 years, and this were followed for 10 years. Out of 104 patients that had completed pembrolizumab therapy, 24 patients achieved a complete response, and only one of these patients so far has progressed, meaning that most of these are ongoing responses. Now, out of 68 patients that achieved a partial response, 64 patients have ongoing responses, and only 4 patients have developed disease progression. What's interesting as well is to really observe the fact that out of 12 patients that achieve stability of disease after 2 years, 10 patients actually are ongoing or have an ongoing response, which really highlights the fact that it is very possible that for those patients that achieved a complete response, those patients may not need to be treated for as long as 2 years, but perhaps for a shorter period of time. In addition to the Keynote 006 study, we also heard an update about the 5-year overall survival of 28% in patients with BRAF mutant advanced cutaneous melanoma. And the fact that there seems to be a tail at the end of this curve, although not confirmed yet, and this data needs to further mature over 5 years to see if indeed this is the case. But there seems to be a special benefit in terms of combined BRAF inhibition and MEK inhibition in patients with normal LDH levels and less than 3 metastatic sites. What's also essential to highlight is that the Combi MB trial investigated the ability of patients with active brain metastasis to really benefit from the combination of the BRAF inhibitor, the dabrafenib, and trametinib. This really was the first study to confirm objectively an objective response rate of about 58% in terms of patients being able to achieve intracranial disease regression. Although the majority of these patients achieved a partial response, the data, it's very compelling and again confirms the ability of this targeted modality of treatment to achieve such success. In addition to the ability of combined BRAF and MEK inhibition, we also learned and heard about the ability of ipilimumab combined with nivolumab within the context of Keynote 204 to mediate intracranial objective tumor regression in about 55% of these patients with a complete response rate of 21%. In addition to this, the ABC trial that was conducted in Australia again highlights now with a longer median follow-up, about 16.4 months, that this ability of mediating complete responses intracranially, it's actually something that can happen. They reported an objective response rate of about 42%, again, in the cohort of patients treated with ipilimumab combined with nivolumab. And in another 2 cohorts where patients were treated with single-agent nivolumab, one which corresponds to treatment-naive patients, the response rate was a little lower, about 20%. And even lower, about 6% in those patients that had some form of previous therapy. These advances highlight now that in those patients with advanced melanoma, we have again several options for treatment. And our ability to learn how to prioritize, it's going to be essential for the future. At the end, we've learned that it is very possible to mediate objective disease and tumor regression to the point that potentially cure some of these patients. So our ability to devise the most logic and beneficial permutations as we treat these patients will become fundamental and will arise from our knowledge to be able to factor in and develop novel predictive biomarkers of response to better understand the immunobiology of these patients.